Mr. Lazos?
Yes.
Hi, my name's Krystal. I'm going to be the nurse practitioner student that's going to be working with you today. Before we get started, I'm just going to wash my hands over here in the sink. I'm going to pull this curtain here to give you some privacy. I also have a sheet here that we'll be draping you with throughout. What we're going to be doing today, I'm going to perform a full head to toe assessment on you. It will involve me putting my hands on you, but none of it should be painful. It'll take a total of about 15 to 20 minutes. If you have any questions throughout, feel free to ask me. Is this okay with you?
Yeah.
You're okay if we begin?
Yeah.
All right, good. First thing I'm going to do, I'm just going to note your general survey. I'm going to note that you have good posture. I'm going to see that, note your manner and your affect, your mood. You don't seem to be in any apparent distress to me. You're smiling, making good eye contact, and nodding appropriately, speaking in full sentences. All right? So we're going to move on to your skin assessment. I'm going to begin this by just assessing the visible parts right now, which would be your head, your hands, and your legs. But throughout the rest of the assessment, I will be assessing your skin as well, everything that I mentioned here. So I'm going to note your color. I'm going to look for signs of cyanosis. I'm going to look for signs of pallor. I don't see any of that. I'm going to look for signs of jaundice. I don't see any of that as well. I'm going to note your hair distribution. It looks equal. The texture looks pretty good. I don't see any bald patches or anything like that. You have good facial hair as well. I'm going to take a look at your hands here. I'm going to look at your nails. I'm going to look at the shape. I'm going to look at the color, again noting any cyanosis or pallor. I can check cap refill as well. I'm going to look for any cracks, lesions, any signs of infection, redness, drainage, and they all look pretty good to me. I'm also just going to note your general facial features. Everything looks symmetrical. Your head looks normocephalic. Okay, and again, yeah, that is a very good thing. And again, we'll be continuing your skin assessment as we go through. I'm going to move generally to your head right now. So I'm just going to assess and inspect. Right now, I'm going to look for any lesions, any markings. I'm also going to note maybe if you have any moles. If you did have moles, we'll do the A, B, C, D, E's. Really important there. I'm going to inspect the symmetry of your ears, your eyes, your nose, and your mouth, and it all looks very well. Now I'm going to inspect your scalp here. Again, noting any lesions, lumps. I don't see anything. No crepitus, nothing like that. I'm going to palpate your facial bones right here. Again, noting any crepitus, anything that seems unstable, and I don't seem to feel any of that. I'm going to palpate your temporal arteries, both of them. Very good. I'm also going to palpate your TMJ joint. And to do this, I'm going to put my hands right here. I'm going to have you open and close your mouth. Good. Any pain with that? No?
No.
Okay, good. I didn't feel any clickings. I didn't hear any clicking as well. All right. So we're going to move on there. Okay, I'm going to start by also assessing cranial nerve 5. And to do that, I'm going to get my little Q-tip out here. All right. I'm going to test both sides of your forehead here. Can you tell me that it's soft or sharp?
It's soft.
Okay. I'm going to do your cheeks.
Oh, okay. Still soft.
Do they feel pretty much equal to in sensation?
Yeah.
Yeah? Okay, and then I'm going to check your chin.
Yeah, it's still soft.
Still soft? Okay, very good. I'm also going to check cranial nerve 7 here. So I'm going to have you wrinkle up your forehead. Good. I'm going to have you squeeze your eyes really, really tight. Good. I'm going to have you puff out your cheeks. I'm going to have you stick out your tongue. I'm going to have you smile. I'm going to have you frown. I'm going to have you clench your teeth really tight. Good. And while you were doing all of that, I was looking for symmetry, in which I did. I didn't see any drooping or anything that was abnormal there.
Okay.
Okay. So that's your head. Now we're going to move on to... Okay, now I'm going to move to your eyes. So first I'm going to inspect your eyebrows. They look symmetrical, good hair distribution. I'm going to do the same thing with your eyelashes, which they all look great. Blinking your eyes fine. Close your eyes for me for a second. I'm going to take a look at your eyelids, which I don't see any discoloration. I don't see any styes or any abnormalities, any lumps. You can open up for me. I'm going to take a look at your palpable folds, which look good as well. They look symmetrical, no drooping or anything like that. I'm going to take a look at your sclera and your conjunctiva. So to do this, I'm just going to pull down on your eyelids. Okay. They look, the sclera looks white. I don't see any jaundice, any hemorrhages, anything like that. His mucosa is pink, no signs of redness or white pale or anything like that. I'm going to palpate your lacrimal apparatus here. I want you to tell me if you feel any tenderness. No? Okay, good. And I didn't feel any fullness. All right. So that's good. Now what I'm going to do is I'm going to check your pupils. To do this, I'm going to shine a light in your eyes, okay? And I'm going to check for pupil restriction, constriction. All right, so I'm going to shine it in your left eye first. Good. And I saw the left and the right eye both constrict. I'm going to do the same thing with your right eye. Very good. They're equal, they're round, reactive to light. I'm also going to check accommodation, so I want you to follow my finger here. Good. Confrontation. Okay. Next, what I'm going to do, I'm going to check cranial nerve 2, which I would have you do the Snell and eye chart. I would have you stand 20 feet away and read the lines for me, the lowest line that you can possibly read. I would have you cover your right eye and then your left eye, and then I would have you look through both eyes. Okay? To check cranial nerves 3, 4, and 6, I'm going to have you do the extraocular movements. Okay? So what I want you to do, I want you to look directly at me and follow my finger with only your eyes. Okay? Very good. He was able to follow me. I didn't see any signs of nystagmus at the borders. Okay? So now what I'm going to do, I'm going to start checking into your eye a little bit more. All right? So first I'm going to shine the light into your eye here. And I see a red reflex. As I come in closer, I'm going to take a look at your optic disc, which seems to have sharp margins. It's a little bit of a yellowish color, which is good. Surrounding color looks fine. I don't see any papilledema. I don't see any hemorrhages. I can see your vessels. I don't see any AV nicking or anything of that nature. Your cup margins look sharp. I see that your cup is smaller than the optic disc. I would do the same thing with the other eye. Okay. All right, and then we are going to move along to your. Okay, now we're going to move on to your ears. So first what I'm going to do is I'm just going to inspect, and your ears look symmetrical to me. I'm going to inspect and palpate the pinna. I want you to tell me if you feel any pain here, any tenderness? No? Okay, good. I don't see any lesions, any bumps, any redness, anything like that. Now what I'm going to do is I'm going to test cranial nerve 8. So I'm going to begin that by performing the whisper test. I'm going to stand behind you and 2 feet to the side, all right? So what I want you to do is I want you to occlude your left ear, and I'm going to whisper through a combination of 3 letters and numbers to you. I want you to repeat them back to me. A31.
A31.
In real life, I would be whispering. And then I'm going to do the same thing for the left ear and have him occlude his right ear. Okay? To continue on testing the cranial nerves, I'm going to do the Weber and the Rhine test. First, I'm going to perform the Weber. I'm going to have a tuning fork. Pretend this is my tuning fork. I'm going to tap it. I'm going to put this in the center of your head here. And I want you to tell me if you feel the vibration equally or more in one or the other ear.
Equally.
Very good. Okay. Next, I'm going to do the Rhine test. What I'm going to do here is I'm going to tap the tuning fork. I'm going to put it behind your ear on your mastoid process. I want you to tell me when you stop hearing the vibration.
Okay.
And then I'm going to move the tuning fork in front of his ear canal. And I want you to again tell me when you can't hear the vibration.
Okay.
Very good. Okay. And air conduction should be 2 times as long as bone conduction. I would do the same thing in the other ear as well. Now I'm going to get my scope. I'm going to take a look inside his ear. To do this, I'm going to pull back on his pinna. I'm going to look inside. I'm going to inspect the middle ear first. I'm going to look for any cerumen. I'm going to look for any foreign objects, any bleeding, any lesions. And then I'm going to progress to the tympanic membrane, which should be pearly gray. I should be able to see through it. It shouldn't be bulging, concave or convex, really. And the landmarks I'm looking for the cone of light, which in his right ear should be at about 5 o'clock. In his left ear should be about 7 o'clock. I should be able to see the short process and the handle of the malleus. In front of that, I should be able to see the umbo, which is right behind the cone of light. And then the incus should be in the back. And I'll do that for both ears. Okay? Next, I'm going to move to your nose. All right? So I'm going to inspect, again, for symmetry, I'm going to inspect to see if there's a deviated septum. I'm going to inspect the nasal mucosa. I'm going to look for redness. Yeah, please tip your head back for me. Very good. I'm going to look at the nasal mucosa for redness, any bogginess, paleness, or any excessive drainage, bleeding, anything like that. I'm going to get the speculum. I'm going to look inside each nostril. I'm going to inspect the turbinates. And I should also be able to see the septum, which should be midline. Okay. All right. I'm also going to palpate your sinuses. All right, so I'll do maxillary first. I want you to tell me if you feel any tenderness here.
No.
Okay.
Good.
And then you can close your eyes for me. I'm going to do the frontal.
Okay. Good.
Very good. Okay. Now we're going to move on to your mouth. All right. Now I'm going to inspect your mouth. Okay. I'm going to take a look at your lips. I'm going to look for any moisture, any cracking. I'm going to look for any signs of cyanosis around your lips, any ulcers, any lesions. I'm going to take a look inside your mouth now, so I'm going to have you open your mouth. I'm going to look at your buccal mucosa for the same things that I was looking for on your lips, basically. I'm going to have you go like this so I can look at your gums. Very good. I don't see any bleeding, any excessive redness or paleness. And again, no sores, anything like that. I'm going to have you open your mouth really wide for me. I'm going to inspect your hard and soft palate, which good, no lesions of that matter. I'm going to have you put your tongue to the roof of your mouth so I can look underneath here. Very good. And then I'm going to inspect the number and the condition of your teeth, so just open your mouth for me. Very good. You brush your teeth twice a day, I can see. Very good. Okay, I'm going to check your posterior oropharynx at this point, so you can open your mouth real big. I'm going to take a look at your tonsils. You can stick your tongue out a little bit. Good. I see his tonsils are at like a +1. His uvula is midline. No excessive redness. I don't see any drainage back there. Any white patches or signs of candidiasis. His posterior pharynx looks good as well. I'm going to assess cranial nerve 12, which is your tongue. So first I'm going to inspect your tongue, which again, I don't see any white patches, any lumps, any ulcers. I'm going to have you stick your tongue out and move it up and down. Good. And side to side. Very good. And I would do that with a tongue depressor against it. Now I'm going to check cranial nerves 9 and 10. So what I'm going to do is, this includes your gag reflex. So I'm going to stick a tongue depressor in the back there and see if you gag.
Oh.
Yeah, good job. I'm also going to have you stick your tongue out and say ah.
Ah.
Good. I could see that his uvula moves up as well as the pillars on the side. Okay. So that looks very good. All right. Now we're going to move to your neck. Okay, now I'm going to move on to your neck. So first thing I'm going to do, I'm just going to inspect. So if you can just tilt your head up for me. I'm going to inspect for any goiters, any lumps, any discolorations, pulsations, anything of that matter. Okay, you can put your head down. Now I'm going to check the strength of your neck, okay, and range of motion. So what I'm going to have you do is I'm going to have you turn your head into my hand here. Good. Good. And you can tilt your head back. You can tilt your head down. Now what I'm going to have you do, I'm going to have you tilt it so that your head can touch your shoulder. Good. And the other way? Very good. Okay. Now I'm going to inspect and palpate the position of your trachea, so just tilt your head up for me. I'm going to stick my right hand on the right side between the trachea and the sternocleidomastoid. I'm going to do the same thing on the left side. The trachea is midline. I don't see any deviations. Again, no pulsations. I'm going to palpate the thyroid, which I'm going to do from behind. So, okay, I'm going to have you tilt your head forward a little bit. Okay, I'm going to displace the thyroid with my right hand just below the cricoid cartilage. I'm going to displace it to the left with my right hand and then palpate with my left. I can feel the lobe. And I'm going to do the same thing on the other side. Okay. Okay. I'm going to come around front here again. I'm just going to have you take a swallow for me. Good. I can see that your Adam's apple and your thyroid moves upwards. To check cranial nerve 11, I'm going to check your shoulder shrug here. So what I'm going to have you do is just push up against my hands. Good. Strong and symmetrical. Very good. Now I'm going to palpate your lymph nodes. So I'm going to go pre-auricular, post-auricular, do occipital back here. Good. I'm going to do tonsillar, submandibular, submental. I'm going to be doing superficial cervical, deep cervical, posterior cervical, and then supraclavicular. I don't feel any lymph nodes. If I did feel any lymph nodes, I would check for the size, the mobility, the shape, if there was any tenderness, if they were red, swollen, or warm. Okay? So we're good there. Okay, we're going to be moving on to your upper extremities next. Okay? So, first thing I'm going to do, why don't we get your shirt off here? Okay? I'll keep you covered up here in case you need it. Good. Okay, good. So I'm going to inspect both of your arms, shoulders, elbows. I want you to tell me if you feel any tenderness.
No.
Nothing here. I'm going to inspect your wrists, your hands, your fingers. Can you move your fingers in and out for me? Very good. Okay, good. I'm going to check your range of motion right now. Okay, first thing I'm going to do is your shoulders. All right, so what I'm going to have you do is I'm going to stand up behind you here. I'm going to have you have your hand next to you. Okay, you don't have to put it under the blanket. That's fine. I'm going to have you lift it above your head. Okay, good. And then I'm going to have you take your hand behind you. Good, very good. Okay, I'm going to have you take your hand and put it behind your back like this. Good. And I'm going to have you take your elbow out like this and lift upwards. Very good. Okay, I'm going to have you move your arm across your body like that. Very good. And then one more time, shoulder to, yep. And then I'm going to have you lift your arm up to the side. Very good. I would do this on both sides. Okay. Now I'm going to inspect your pulses. I'm going to first do your radial pulse. I'm going to assess for rhythm, amplitude. Very good. I'm going to do the same thing with your brachial. Very good. And then I'm also going to assess your epitrochlear lymph nodes, which I don't feel. Okay, very good. I would do the same thing on the other side of your arm. Okay. Okay, now I'm going to move along to your back. So, first things first, I'm going to inspect your spine. I'm going to see that it's straight down. I'm going to also palpate for any step-offs, any tenderness. Does any of this hurt? No? Okay. I can see that his spine is straight, no signs of scoliosis. I'm also going to palpate the paravertebral musculature. Any tenderness when I'm doing this? Okay. Then I'm going to assess for CVA tenderness. So what I'm going to do, I'm going to put my hand here. I want you to tell me if any of this hurts.
Nope.
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 No? No pain. Okay. Very good. Now I'm going to move on to the posterior chest and lungs. Okay. Now I'm going to assess the rate, rhythm, and depth of your respirations. And they all look equal. I don't see any retractions, any unequal breath sounds. Now I'm going to palpate for your chest expansion. So I'm going to put my thumb around the sides of like the 10th rib. I'm going to squeeze a little bit. Take a big deep breath for me. In and out. And I can see equal chest rise. Very good. I'm also going to palpate for tactile fremitus. So what I want you to do here, sir, I'm going to have you say 99 over and over again. Okay? Go ahead.
99, 99, 99, 99.
Very good. And the vibration was equal throughout. Now I'm going to percuss the lung fields. So start doing this. Okay. I'm going to progress in a ladder-like fashion. And what I should be hearing here is resonance over the lung fields, which I do. Okay. Then I'm going to percuss for diaphragmatic exertion. So to do that, I'm going to be a little bit above and parallel of where the diaphragm dullness is, and then I'm going to percuss my way down until I hear the dullness. Okay. Then I'm going to have my stethoscope. With the diaphragm and my stethoscope, I'm going to listen to all the lung fields. So I'm going to have you take a deep breath in and out. And again, I'm going to progress in the ladder-like fashion. Keep going in and out. And I'm going to make my way all the way down while also listening to the midclavicular. Okay? All right. Very good. So now, sir, what I'm going to have you do, I'm going to have you lay down. Okay? You can actually lay down on this pillow a little bit. I'd like to have you at about 30 degrees. Okay. And again, we'll keep you covered up here. Little like this. All right, so I'm going to inspect the anterior chest here. I'm going to look for any heaves, thrills, bruits, anything of that nature. Again, I'm looking for symmetrical chest rise. I'm going to palpate the anterior chest as well. I don't feel any heaves, thrills, or bruits. Then I'm going to move down to the heart. And what I'm going to do here first is I'm going to inspect and palpate your carotid pulses. I'm going to do one at a time. So I'm going to do your right one first. Very good. Then move over to your left. Very good. I would assess for any JVD, which I don't see in this respect. Then I'm going to move down to inspecting your precordium. I'm also going to palpate for the same thing I was doing with the anterior chest. So I'm going to palpate along here. Very good. I'm going to palpate over here. I'm also going to palpate for any pulsations. I'm going to palpate the apical pulse, which is the 5th intercostal space, midclavicular line. Okay. Next, I'm going to move into auscultation. So first thing I'm going to do, I'm going to listen to both of your carotids. Okay, I'm going to listen for any bruits. So I'm going to do this with the diaphragm and the bell on both sides. I don't hear any. Very good. Next, I'm going to move back to your heart. So I'm going to listen to the 2nd intercostal space, right sternal border, for your aortic valve. Then I'm going to move to your pulmonic, which is the 2nd intercostal space, left sternal border. We'll listen to Erb's point, which is the 3rd intercostal space, left sternal border. The tricuspid valve, which is the 4th intercostal space, midclavicula. No, left sternal border, sorry. And then I'm going to move over back to where your mitral valve is, which is 5th intercostal space, midclavicular. Okay. I'm going to do that with the diaphragm and the bell. I'm going to be listening for any murmurs. I don't hear any. I'm going to have you turn onto your left side, which is the left line decubitus position. Again, I'm going to palpate the apical pulse. And then I'm also going to listen for any murmurs at that time. Okay? I'm going to have you sit up really quick. I'm going to have you sit forward. And I'm going to have you take a deep breath. Yep. When he's doing this, take a deep breath and hold it. Good, and you can let go. I'm listening to his left sternal border for any aortic murmurs, and I don't hear any. Okay, very good. So you can resume lying down. Very good. Now we're going to move to your abdomen. Okay, so I'm going to now we're going to move down to your abdomen. So I'm just going to expose your stomach here a little bit. All right, I'm going to first inspect for any pulsations, any asymmetry. I'm going to look for any striae. Any vessel, any ascites, which I don't see. I can see the contour and the shape of it. Okay, so now I'm going to move on. I'm going to first listen. I'm going to auscultate in all 4 quadrants with the diaphragm. I'm going to be listening for vowel sounds, and I hear them. Now I'm going to listen over the aorta for any bruits. I'm going to listen to the aorta for any bruits, which I don't hear. Then I'm going to move to the renal arteries, right and left. I'm going to move to the iliac arteries, right and left. And then the same thing with the femoral arteries. Just a little bit underneath here, right and left. And I didn't hear any bruits there. All right, so now I'm going to percuss. I'm going to percuss in all 4 quadrants. I should be able to hear tympany and then some dullness over the liver or any other organs. I'm also going to percuss so that I can see the size of your liver, okay? So I'm initially going to start at the area of the umbilicus, and then I'm going to move my way up until I go from tympany to dullness. Which is right there. And then I'll move down from the nipple line downwards from when I would go from resonance to dullness. And I would do that all in the mid-clavicular line, and then I would measure the distance in between the percussion. All right. Now I'm going to start palpation. I'm first going to do light palpation. I want you to tell me if you have any tenderness here, okay?
No.
And again, I'm assessing for rebound tenderness. I'm also assessing for any masses or any enlargements. Then I'm going to progress with deep palpation. Again, I want you to tell me if you feel any tenderness. Good. Do that in all 4 quadrants. Very good. Now I'm going to palpate your liver. Okay? So I'm going to stick my left hand underneath your back. Very good. And I'm going to push upwards. As I'm doing that, I'm going to push underneath the ribs so I can feel the bottom, the tip of the liver. And I do. Very good. I'm going to do the same thing over here with the spleen. Okay, and relax back. Very good. Okay. If I felt that your spleen was enlarged, I would have you turn on your right side as well if I needed to palpate it, but I don't. Okay. Okay. All right, so now we're going to move down to your leg. Okay, now I'm going to move to your lower extremities. So I'm going to take this off you. I'm going to cover you up in the top area. Okay. There we go. Is that comfortable right there? Mm-hmm. Very good. All right. So first I'm going to inspect the hips. I'm going to inspect and palpate the quads, the knees, all the way down the thighs. Any tenderness when I'm doing any of this? I'm going to take your socks off.
Okay.
Whew. I'm going to inspect your feet. Very good. All right. I'm going to come on back up here. First, I'm gonna palpate your inguinal lymph nodes.
Okay.
Up here. I'm gonna do that bilaterally. I don't feel any. I'm also gonna do pulses while I'm up here. All right. So your femoral pulse, I'm gonna feel bilaterally. I'm gonna feel your popliteal. You can bend your knee just a little bit for me. Perfect. Good. Both. I'm gonna move down here to your posterior tibial, right behind the ankle, malleus. And then your dorsalis pedis. Good strong pulses bilaterally. Very good. I can also note while I'm here that he's got good color. No signs of peripheral edema as I'm moving down here. Okay, so now we're going to work on some range of motion. All right. So we're going to first work on your hip. Okay, so I'm going to have you bring your knee to your chest. Very good. Any pain with that? No? Okay. And you would do the same thing with your other leg, but okay, good. And then I'm going to have you turn on your back really quick. Okay. I'm going to have you lift up your leg here, but at your hip. That's your knee. Keep going, hip. There we go. Okay. Very good. And while I'm here, I also noticed that he has some good knee flexion as well. Okay. You can turn on back over. All right, very good. Okay, now we're going to test abduction and adduction. So I'm going to have you take your leg here. I'm going to have it bring it towards your other leg. Very good, and then outwards towards me. Very good. And then your knee. We know you can already bend it backwards. I'm going to have you sit up really quick. Have your leg dangling off and extend your knee out. Very good. Okay, and you can lay on back. Now I'm going to move on down to your ankles. I'm going to have you pull them up towards you and press down like you're going on a gas pedal. Good. And then I'm going to have you turn your ankle bone so that it goes inwards and outwards. Very good. And then I'll have see if you can turn the top part of your foot so that it goes inwards. Very good. And then outwards. Very good. Okay. And then wiggle your toes for me. Very good. Can you point them downwards and lift them upwards? Very good. Okay. So I'm going to have you sit back up again on the edge here. Would you like to be draped?
Sure.
Okay, I'll put it over your shoulders. All right, now we're going to move on to neurological. All right, so what I'm first going to do, I'm going to take one of your arms here. Okay, just going to expose this shoulder here. Okay, I'm going to check your sensations here. So I want you to tell me if what you're feeling on your arm is sharp or dull or soft.
Sharp. Soft. Sharp. Soft. Soft. Soft.
Very good. Okay, I'll get my tuning fork again. I'm going to test your vibrations. So I'm going to put this on one of your joints here. I'm going to tap the tuning fork, and I want you to tell me what you feel here.
Vibration.
Very good. Okay. All right. Next, I'm going to put an object in your hand. I want you to tell me what it is. Okay, close your eyes for me. Very good. You can move it around.
Is it a paper clip?
Yep. Very good. And now I'm going to draw something in your hands. Okay, I want you to tell me what it is.
Is that the number 3?
Yes. Very good. Okay. Now what I'm going to have you do, I'm going to have you test your grip strength. Squeeze both my hands as tight as you can. Very good. Okay, I'm just going to put that off you for a second. All right, now we're going to check your fine motor skills. So what I want you to do is with your right hand, I want you to touch your nose and then touch my finger. Do it back and forth as fast as you can. Okay? Good. Good. And do the same thing with your left. Very good. Okay. Very good. All right, now I'm going to check your tendon reflexes, your deep tendon reflexes. First, I'm going to check your biceps. Hammer. Good. And I would see knee jerk there. I'm also going to check your triceps. I would see extension of the arm there. And I'm going to check the brachioradialis. Tap there. Very good. Now I'm going to move down to your lower extremities. So I'm going to have you, okay, what I'm going to have you do is I'm going to have you take your shin, or your heel, and I'm going to have you roll it down your shin. Very good. And you can do both legs. Very good. Okay. Now I'm going to check your deep tendon reflexes in your legs. Ideally, I would like your legs to be hanging here. That's okay. Thanks. All right, I'm going to check your patellar. And I would have, his knee would kick out. I'm going to check your Achilles. Back there. Good. And then I'm going to check your foot here for any Babinski. So I'm going to come outside and around. Good. Okay. And again, I would do that on both sides. All right, now I'm going to have you stand up for me. I'm going to test how you test your gait and see how you walk. Okay, so I'm going to have you start right here, and then you can walk down here. Very good. On the way back, I want you to do heel to toe in front of each other. Very good. All right, now what I want you to do, I'd like you to walk on just your heels down this way. And then I'll have you walk on your toes on the way back. Very good. I'm going to have you stand on one leg and hop up and down. Very good. And you can switch legs. Careful to fan. And then I'm going to have you stand on one leg again and do a shallow knee bend. Very good. You don't have to jump, just a knee bend. Very good. You can do the same thing on the other leg. Good. Now you can come over here to me. I'm going to do a Romberg test on you. You can stand in front of me here. Okay. So what I want you to do, I want you to just close your eyes, hands down beside you. And I would do this for about 30 seconds, see if he fell either way or rotated back to, side to side. Okay, you can open your eyes. Now what I'm going to have you do, I'm going to have you hold your hands out in front of you with your palms to the sky and close all the way out extended.
Oh, okay.
And close your eyes. Very good. I was looking for a pronator drift. I don't see any. Very good. Okay. I'm going to check your spine. So I'm going to have you turn around for me. I'm going to have you, as you bend down, I'm going to check your spine for any alterations. Very good. And his spine is straight down. I don't have to worry about any scoliosis. Very good. I don't see any lumps or anything like that. That also checks his flexion of his back. And what I'm going to have you do now, so you can stand straight back up. I'm going to have you extend your back backwards. Very good. Lean back at your hip. Very good. Okay. And then, okay, you can stand up straight for me. I'm going to have you rotate at your hips side to side.
Like that, or?
Sorry. Rotate it like that. Very good. And then I'm going to have you can face me if you want. I'm going to have you bend down at your hips and try and touch the side. Very good. And the other way. Very good. All right, Mr. Lazos. I think we're all done here. You did fantastic. I'll have you get changed. Do you have any questions for me before we go?
No, I'm good.
I think you're healthy. All right, very good. I'm going to wash my hands again. We're done.